In my recent newsletter, I was talking about this research article that I came across well, I guess it's probably maybe a month and a half ago now, and it was all about something called vitamin D receptor resistance. And since I sent out that newsletter, I've had a few patients reach out saying, "This sounds really exciting. This is, sounds like something I want to be assessed for." And so I thought I'd do a video about this because it sounds like it's a topic that's of interest. So there's a group of clinicians in the from Germany, if memory serves. I think they work at the Cambria Institute, Cambria, I think, but I don't remember for sure off the top of my head. And they, for several years ago, they published an article, or a research article, about the approach that they use to assess patients for what they call vitamin D receptor resistance. And the gist of it, to my understanding, is that some folks, it seems that their vitamin D receptors just aren't as responsive to the presence of vitamin D as the average person's might be, and that can lead to the symptoms of vitamin D deficiency, even if a person is taking enough vitamin D as a supplement or getting enough sun exposure or whatnot. And vitamin D is incredibly important. I'm sure pretty much anyone listening to my videos knows that because you're obviously interested in your health. And if there is a vitamin D deficiency, one of the more severe outcomes that can come from that is that it puts us at a greater risk for autoimmune disease. And there's interesting reasons behind why that's probably the case. But the long story short is that these researchers basically run a test to determine whether patients who are suffering from autoimmune conditions or different chronic maladies that aren't necessarily classically considered to be autoimmune, but sometimes get lumped into a bit of a fringe category around that, like chronic fatigue syndrome or fibromyalgia. And they have found that if the patients were tested for vitamin D receptor resistance, and they then supplemented with adequate amounts of vitamin D, then they found significant clinical improvements. So it's quite an exciting idea because treating autoimmunity, sometimes goes quite well and is quite easy, and sometimes it's very, very difficult to make any headway. So the way the test works is a person needs to have their vitamin D level tested at the same time that their parathyroid hormone level is tested. And my understanding of it is that if the vitamin D level is adequate, like if it's a robust level of vitamin D, then the level of parathyroid hormone should be fairly low. However, if the level of vitamin D is adequate and the parathyroid level is either high or high normal, then that suggests that there may be a vitamin D receptor resistance issue going on. And then the patients may need to be supplemented with very, very high amounts of vitamin D. Now, as per usual, everything I'm saying in my videos is for informational purposes only, and should not be construed as medical advice because it's not medical advice. But it's particularly important to, if one was going to work with higher dose vitamin D, to make sure they're doing that under the guidance of a qualified healthcare practitioner, because taking in too much vitamin D can potentially be dangerous. In my experience, even at high doses, vitamin D is oftentimes very, very, very safe, but it is possible. So it's not like, I'm taking a lot of vitamin C, and worst case scenario, I urinate out whatever I don't need, and maybe it gives me diarrhea. Higher dose vitamin D can be serious if it's not done properly. So I'm in the process of working with some patients who are getting this testing done. So I don't have any clinical experience with this yet, but it's something that I'm excited about, and I will post further videos about it down the road. But if anybody has any questions or comments about this, or if you're listening to this and you've had this testing done, or you have worked with a super, super high dose vitamin D protocol before and it's been beneficial or not beneficial, I'd love to hear about it. If you want to post it in the comment section below, or DM me if you prefer. So I will leave it there for now, and I will hopefully have another interesting video topic for you soon.